When I teach, many people think that tension is sort of the opposite of relaxation. It goes like this: don't be tense, just relax. What I tried to point out in the relaxation video about how we develop the skills around that is that relaxation is too broad a word, it's non-specific, and most people can't do it anyway. And you know that. You know when you say to yourself, just try to relax, or when someone says to you, just relax for goodness sakes. It's hard, and it doesn't tell us where and how to do it. Tension's a little more complex. Tension turns out to be fourfold. And we had to stumble across this. We stumbled across it because we thought it might just be tension, and then we discovered it was more than that. So we have conscious tension. I talked in another video about seeing a woman standing up against a wall with her shoulders up around her ears and up on tippy toes and her butt clenched tight. That you call tension. And the response is often just relax or drop your shoulders or get down off your toes. But that's not the point. But that is conscious tension. In other words, she can consciously drop her shoulders, or she can consciously get down off her toes, or even unclench her butt. So conscious tension is the most obvious. Unconscious tension is less obvious, and as chiropractors, you actually work with unconscious tension a lot of the time. But for most of us as lay people, we don't even know what unconscious tension is until we see it. So if we see somebody walking down the street like this, or walking down the street like that, that's unconscious tension. They don't even know they're doing it. It's become such a habit in their body that that's how their body now is moving through space. And that's unconscious tension. Then you have structural tension. And structural tension, for instance, is the inside of the birth canal. How tight are the muscles in there? Often you hear men say, "Oh, I really like it, she's tight." Or, after she had her baby, she was so loose. Women get very upset about this. And one of the reasons that the elective cesarean rate rose so rapidly in South America during the 1980s and 90s was the fact that women wanted to stay tight for their husbands, and they didn't want to damage their birth canal. And why is that important? Because one of the groups that I worked with in the early 70s was women my age and younger whose bodies had been damaged by having natural birth. Because the word natural can mean anything that might happen can happen. And you do not know how many women have post-birth physical trauma that we just treat as, well, that's the most natural thing. Well, it doesn't have to be that way. And what we found was that as we prepared our body and worked with the tensions, the four tensions, that we were able to spot them, recognize them, do something about it, and change them. And that helped both us in terms of coping and managing throughout the birth we were having, and it also helped this big object move down through and out us one way or the other. So structural tension is tension that is built into our body. Then there's stretching tension. You know, if you say to a man, you got a grapefruit that's going to come out the hole in your penis, ask him what he thinks about that. He knows that's stretching tension, and he knows he'd rather prepare his penis to have that happen. What happens with women is that all of this is going on the inside of us, so we can't see it. So it makes it harder for us to think about, well, how am I going to change this? And we change it by not being afraid of our body. Doing the internal work from 32 weeks onward is absolutely an essential skill. Perineal massage is merely stretching the outlet tension, the structural tension of the outlet of the vagina and the tissue between the back of the vagina and the front of the rectum. That's the last place. That's the ring of fire that the baby's coming through. But to get to the ring of fire, the baby has to have moved through the cervix, down into the top of the birth canal, which is at the bottom part of the sacrum, pushing the sacrum back and out, moving past the tailbone, moving into the muscles behind and to the side of the rectum, even before it begins to open, the beginning of the outlet of the birth canal. So all of that needs to be relaxed. That's stretching and structural tension. And it can be conscious tension, or it can be unconscious tension as well. When I gave birth first in 1970, we lay on our back, feet up in stirrups. The natural birth movement went, it's not gravity. It's right, it isn't gravity. However, if you get into that position now, your pelvis is wide open. So instead, get into a semi-recumbent position in which you're sitting basically on the bottom part of your sacrum. Feel how that closes what was open, but more importantly, it blocks the baby's ability to push the sacrum back and out. And that's why you see women trying to lift off and trying to move to one side, or pushing until the veins in their eyeballs rupture. And it is because nobody is trained as a body worker in birth. They're trained in anatomy and physiology. So when we're dealing with tension, we have to recognize these four. Conscious, easy, see it, stop it. Subconscious, don't see it, often a habit. So think right now as you're sitting here listening to this, just soften inside your pelvis. Soften in your bum muscles. Did anything change? If it did, you were carrying some form of tension. Some of that's weight-bearing tension. So, for example, we are told women get up and walk in labor. There are many women who walk in labor and their labors are delayed. Why? Because we're creating weight-bearing tension. And not only that, but every time we put one foot forward, we create an asymmetrical tension in our pelvis. And the other foot forward creates an opposite asymmetrical tension. And how does this matter to anything? The baby inside us is trying to adjust to the changes in our body. Often if a woman is having a very progressive labor and she's going, I can't cope with it, it's just so painful. And a care provider tells her, just get on your hands and knees. And so the woman gets on her hands and knees and the contractions back off. She has more space in between and the contractions aren't as intense. And she goes, oh, thank God I have a rest. Well, think about it. What has just happened? When she's on her hands and knees, she's lying on her belly. The only thing that's upright are her thighs and her arms. And the baby is falling forward and down towards the floor in her pelvis. And so the baby is telling the mother, you're not in a good position for me. But the mother, who doesn't have skills, is thinking, oh, I get a break. But on the other hand, that break can cause labor to go on for hours and hours and hours and hours. So it is preference for women to have skills so that they can cope and manage with the intensity and also effectively open up, create mobility, and create space in the area that the baby needs to utilize. It's not our throat, it's not our ears, it's not our toes, it's the inside of our pelvis and the inside of the birth canal. So just remember the four tensions: conscious, subconscious, structural, and stretching. And what you want to do is apply skills to all four of those. And when you apply skills to all four of those, and you also get into positions, which is a whole other set of skills, and every contraction has a good peak to it, and your contractions every hour or so are getting longer, stronger, and closer together, your labor is progressing. If you're having a cesarean, you have to get to the hospital. You're in a car, and you're having emotional feelings. It's exciting. It's daunting. You get nervous. So just use your skills to keep reducing any tensions that you have. When you're getting prepped, you may not feel good about it. You may have pain, or you may be delayed, or you may be in a cold room. Just keep using all of your skills. It's your baby's activity. This is how it's unfolding. It may not be what you chose, or it may be exactly what you wanted, but it's not as pleasant as you thought. Birth doesn't have to be pleasant. It needs to be manageable. And we can manage it when we are highly skilled. When you're on the table and you're having surgery, it's the same thing. That's your baby's birth. So continue to use skills. Don't allow the drape between your head and your crotch to disconnect your head from your body. Even though it is numb, you stay engaged and have your partner stay engaged with you.